Hello, my name is Gerben Keijzers. I am a staff specialist emergency physician at Gold Coast Health. I also have an adjunct professor role with both Bond University and Griffith University, both at the Gold Coast. My background is a research degree back in the Netherlands. I did an epidemiology degree in the 90s and then moved on to a medical degree. I moved to Australia in the early 2000s where I started emergency medicine. I became an emergency medicine specialist in 2008 and then did a PhD in quality of trauma care in 2010 to 2014. With the opening of the new Gold Coast University Hospital in Queensland in 2013, there was lots of opportunities for academic work to happen, because with a new tertiary university hospital, opportunities come. So in 2014, different clinicians and academics within Gold Coast Emergency trying to formalize the way we do research by having an infrastructure, pillars of research, areas of research priority that aligns with both departmental, hospital and statewide policies and priorities. So as a result, we've tried to pick the topics that are important for quality of care, and that's important for both the patients, the staff, as well as policymakers and administrators. So with that in mind, we've developed our infrastructure of research and managed to collaborate widely, both within the hospital as well as with other hospitals, as well as internationally, to become more competitive within the research arena and go from small grants to medium-sized grants to large national competitive grants in that last sort of 10 years. And I think in general, at the moment, Gold Coast Emergency would probably be viewed by most other emergencies as a very productive and successful research group. Within Gold Coast Health, where I've been an emergency physician, I've become a clinician researcher where I do half-time clinical work and the other half-time is focused on academic components, which is both medical student teaching as well as research. Over the last 15 years, I've been involved with developing collaborations and research infrastructures within Gold Coast Health, which has led to 7 pillars of research that have its own groups and its own interest areas, and I've been sort of co-leading the overall ED collaborative research group. Myself, I've been primarily interested and involved with critical care studies that span sepsis, fluid resuscitation studies, antimicrobial stewardship work, pneumothorax, so things that relate to critical care and emergency medicine, with also a focus on research that try to reduce unnecessary low-value care. So in the last 5 to 10 years, I've been involved in probably 100 plus publications, 20 plus grant applications, and I'm now involved with multiple multi-site collaborative research projects, and I'm trying to encourage critical thinking and curiosity through research and education to my clinical staff. So low-value care is where we do tests and treatments where the benefit is very low. So we may end up providing a scan for somebody where we think that the chance we're going to find something is so low, but we still do it because it's ingrained in our nature to want to do things. So doing tests that have a very low chance of finding something will cost money, will still have adverse events, and may even find things that are not clinically relevant. So that's an example of low-value care. Providing antibiotics for somebody who clearly has a viral illness is often also seen as a clear example of low-value care. So things that cost time, money, and resources with potentially more side effects than benefits is a definition of low-value care. My passion is driven from curiosity and asking questions and challenging dogma. There's so many things in medicine at the moment that we do that are based on old beliefs. This is how we've always done it. This is just the way we do it. And I think actually asking, having that probing nature and that assertiveness to say, do we really need to do this? Although we've done this for the last 10, 20, 30 years, is it really the right way to go about it? And by showcasing that's how I think, I would like to then, give that idea of questioning, that curiosity, that challenging of behaviors to everybody else in the department. That we do things not because we've always done it, but because it's got good data to support it, that it makes sense, that it's actually evidence-based. So the passion is really driven by curiosity and challenging people to think critically. I like to keep fit. I'd like to do bushwalks. I like to do martial arts. I have 2 border collies, so they're by definition quite active. So we'll take them to the beach for a walk and a swim and a fetch. So a combination of outdoor walking, exercising, and canine engagement.